Good morning and welcome back to GP Video Podcast by Nadia. Yesterday we started talking about cholesterol lowering medications and how important it is for us to take cholesterol lowering medications if our cholesterol levels are more than 60 milligrams per deciliter. As I said yesterday also, that 1 in 5 people in the developed countries die because of the heart disease, and heart disease is very, very easily preventable if we talk about the preventable modifiable risk factors, which are obesity, increased blood pressure, and increased cholesterol levels, and diabetes or increased sugar levels. So even if all the other risk factors, like you are not obese, your insulin resistance, you are not insulin resistant, you are insulin sensitive, you are not a diabetic, and your blood pressure is normal, but even then all of these risk factors are optimal, but your blood cholesterol levels are high, you are still at increased risk of developing heart disease. And it's important, if your blood cholesterol levels are constantly higher than 60 milligrams per deciliter, and especially if your LDL cholesterol is high, which is the low density lipoprotein cholesterol, then it is very important to be on cholesterol lowering medications, because cholesterol lowering medications will reduce your cholesterol levels, and there is decreased chances of getting your coronary arteries blocked, which means that you are at decreased levels of getting heart disease. So cholesterol lowering medications, there are 4 of them which we can use. 2 of them are there in the market and are being used. The other 2 are also in the market, but at the moment are very expensive. Therefore, they are not used that readily. But then there are chances that the costs are going to come down and they are going to be also available in the market. Number 1 is statin. A low dose statin is a very good medication for lowering cholesterol levels. Now, statins have got a very bad name online and in the market because of some of the myths. So yes, statins can cause muscle pain, but the chances are very few. So for example, 1 in 2 people out of 100 can have muscle pain. And then this chance also reduces a lot if you are on a low dose statin. So higher dose statins can cause muscle pain, but low dose statin very, very rarely cause muscular pain. And low dose statin can actually 85 to 90% control your cholesterol levels. So let's say 5 milligram of rosuvastatin or 10 milligram of simvastatin, stuff like that. So 5 to 10 milligram of any hydrophilic statin is a very good idea to start a patient on. So then also at high levels you can have increased liver enzymes, but at low levels of statins, again, it's very, like, the side effects are very rare on low dose statins. The other option is that if low dose statin are not giving you a desired effect of, the cholesterol levels, and they are not coming down less than 60 milligrams per deciliter, the other option is to start 10 milligram of ezetimibe. So instead of increasing the statin dose, what we can do is we can combine the statin, 5 milligram of rosuvastatin or simvastatin, with what? With ezetimibe, which is 10 milligram of ezetimibe. So with 10 milligram of ezetimibe, combining it with the low dose statin will give you lesser side effects and will provide a better control of the cholesterol levels. So these are the 2 drugs which are available in the market and which can be used. The earlier idea was that, okay, once the statin levels, once the cholesterol levels are lower than 60 milligram per deciliter, we can go off statin. No, actually, being on statin for a longer period of time reduces the heart disease risk more and more. So and then there is another myth that, oh, if we lower down the cholesterol levels, it's going to be like, if they are very low, it's going to be not good for the body, because body still needs cholesterol. So the thing is that body produces its own cholesterol, brain produces its own cholesterol, liver produces own cholesterol. So if we lower down the levels to very low, it's not going to endanger the body at all. The other two options are PCSK9 inhibitors. The problem with them, they are very good in lowering cholesterol levels as well, but the problem is that they are injectables and they are very expensive. And the fourth one is bempedoic acid. So bempedoic acid is a new kid on the block, and it's actually doing very good because it has got very less side effects, and it's a very good medication for lowering cholesterol, and it's an oral medication. But again, the problem is that it's very expensive. But the chances are that once the costs come down, it's actually going to replace statins, because it doesn't have side effects like statins, like the muscular pain and other side effects. So there is another side effect associated with statin, which is like it can, in higher doses, it can like deteriorate a bit of insulin resistance. But again, it is still given to the insulin resistant patients because it reduces heart disease, so it's still given to it, but still given to people who are insulin resistant. But bempedoic acid actually improves insulin resistance, does not produce muscular problems, so in the future it is actually going to replace statins. That's a speculation, but at the moment statins are very, very good. Ezetimibe is very good. Low dose statin and ezetimibe combination is very, very good to be on. The two supplements that are very good for lowering blood cholesterol levels, number one is omega-3 and number two is Bunbarine. Apart from these two supplements, there is no other supplement that is advised for lowering blood cholesterol levels. Thank you so much. See you tomorrow.